Hello, my name is Dr. Harvey Castro. I'm an ER board certified physician, and I'm happy to say that I'm the first doctor to ever write a book on ChatGPT and healthcare. So thank you for joining, and we'll just jump right in. I changed up my slides a little. I wanted to start with this kind of amazing story that was in the news recently, and it's basically about a young boy who unfortunately saw 17 doctors in over a 3 year span, was having chronic pain, and mom was really upset that they could not figure out what was wrong. And she took all the notes of the patient, all the MRI notes, and literally plugged them into ChatGPT. ChatGPT said it was actually tethered cord syndrome, and basically, a neurosurgeon went back, looked at the films again, and said, "You know what? It actually is." So I kind of like starting with that just because it could just show you the power of ChatGPT. And so when I look at ChatGPT, I look at it kind of personally like a friend. It's someone that I can talk to 24/7. He or she is literally there for me. And I point out this slide because ChatGPT's IQ is of 155. That is unreal to me. That's superior than 99.9% of the test takers, according to Scientific America. This article came out in March 28. And the reason I love this slide is just to show you, I mean, if this thing is doing that well, how well can it help us in healthcare? Specifically, myself, I'm an ER doc, so I'd love to see what it can do. Just as an aside, the average doctor's IQ is somewhere between 115 and 120. The average person is somewhere between 80 and 110. Elon Musk is around 115. Albert Einstein's about 115. So ChatGPT is in good company. So how does it work? I know there's a lot of scientists out there and they basically know, but let me spin it towards healthcare. The big thing about ChatGPT is this reinforced learning from human feedback. I'm going to go on a tangent here and say we need the right reinforcement in healthcare. We need a doctor to do it. No offense to the people that were doing it, they did a great job. But if we have a large language model that is specifically for healthcare, then we need something that's being reinforced by the doctors. Now, just because I'm an MD doesn't mean I get to vet every single thing that's out there. No. In fact, I'm saying it has to be the right doctor. So since I'm an ER doctor, I should, in theory, be able to reinforce large language models in emergency rooms. And so, how can we use this in healthcare? Well, number one, I'm telling my patients, you know what? Go into ChatGPT. Any medical diagnosis like your diabetes, hypertension, any questions, go ahead and put it into ChatGPT and tell it, how can I make better questions? What follow up questions should I have? Unfortunately, the average patient only gets about 13 minutes with their doctor. Why not make that the best 13 minutes? And unfortunately, that's once a year. So if you think about it, you're only spending time with an expert once a year. So why not have the best 13 minutes and use ChatGPT? And so from a patient's point of view, what are some of the good things? Well, I feel like in the future, I'm open to it. Having a computer, having your doctor, me, and you, let's say as my patient, and let's just work through your medical conditions together. And then let's use the power of ChatGPT. I may not explain things correctly. Sometimes I think as a doctor, in the sense that I'm saying medical terms, and in my mind, I'm like, oh, yeah, they understand this. But in reality, they don't. And unfortunately, patients are not going to correct doctors. So I'm saying, you know what? Let's use ChatGPT to help us make sure that we're translating correctly. And when I mean translating, meaning from medical language to regular language. And believe it or not, a lot of doctors struggle with this. The other is, I talked about vetting this information. One of my worries is patients are using ChatGPT, and I just said use it, but they're not asking a doctor to see what they think or an expert. And that's where I start worrying because later we're going to talk about hallucinations, and this could be an issue definitely in healthcare. Post visits, again, I think it's an amazing tool that we can put information to ChatGPT and can improve our websites, improve our discharge instructions. This slide is actually one of my favorite slides. I'm gonna say I'm a little biased here because what this hospital did in England, I'm going blank on the name, but basically they took ChatGPT discharge instructions. They had a 5-year-old child that basically was just diagnosed with asthma, and normally you just tell them what to do, what not to do, and then give them discharge papers. And obviously, he's 5 year old, so you're talking to the parents, but you're doing your best to teach the child. Well, they took those same papers, fed it into ChatGPT, and said, change the language as if you were talking to a 5-year old. Then, this is the best part. They took all the theory from the discharge instructions and put it into Midjourney and created artwork and then created a coloring book. And then they said to the patient, "Here you go." And now the doctor, the nurse, the parents could literally color with the patient, talk to the child. And I thought, man, this is the way to do healthcare. I mean, we need to have more of this kind of stuff. Um, the next thing about ChatGPT and healthcare, well, guess what? Medical knowledge doubles every 30 days. I mean, that's unreal. Imagine, unfortunately, I've been out of med school for over 20 years, so I've had to keep up. But back in the 1950s, medical knowledge would double every 50 years. And so, in theory, you could be a doctor in the 1950s, spend 10 years and not learn anything, and you would be okay. I mean, medical knowledge hadn't changed that much. But today, you can't even take a month off because if you do, you're behind. And so, we need the power of ChatGPT to be able to help us with our up-to-date information and journals, and then package that and then give it to us every week so that we're able to keep up with all the things that are out there. To that effect, one of my colleagues found this, and it's pretty cool. It's a little off medical, but I think it'd be applied in medicine. But basically, it's called Data Science AI Tutor, and all it is a bot that's helping you learn about data science. And I thought, man, this exact platform would be awesome to have in medicine. So obviously, we need to talk about the bad. Let's talk about hallucinations. Everybody knows what that is, but the skinny, I like giving it in a healthcare example. So I'm an ER doc, love emergency medicine. I feel I'm pretty good in ER, but I really have no business in surgery. And so let me explain. So if let's pretend you had a medical question and it had to do with surgery and you wanted to know the procedures of how to take out an appendix, I would be able to put that into ChatGPT, read it, and be like, yeah, this looks pretty good to me, and then say to the patient, "Yeah, fine." But then in reality, it's actually hallucinating because it may not be 100% correct. So I show that same output, give it to a surgeon, they read it, and they literally start laughing at me saying, "No, man, this is not how we take out appendix. Maybe 20 years ago this was it, but this is all wrong." And so you see how this could kind of fool us. And I'm really worried about us as a society. How is this gonna affect us in healthcare? And so I'm out there trying to help our patients, our healthcare providers to learn the good, the bad, and the ugly. I think we need something called BioGPT, which, to cut to the chase, is just think of PubMed and all the medical references under one large language model, and that is really helping us with healthcare. Obviously, we have biases in the database, and I know you guys know probably better than me about all the different ways that biases can influence. But imagine in healthcare. Imagine someone outside of the United States possibly using ChatGPT for a specific problem, and that problem is in the database, but unfortunately it's in the database for Americans or for a subtype of a person here in the United States. And so now it really will not apply and it actually may not work. And so these kind of things we need to be aware. Obviously, it has a huge carbon footprint. The ethics that's involved, I'm personally worried about the internet gap. You know, we have people around the world that do not have the internet. And I know people are like, there's no way. No, there are. There's tons of people. And also from a financial point, so, work with me here for a sec. What if I told you that if I could improve your healthcare through GPT, I could get you to live longer, live better, and as a result, your healthcare, what I call IQ, will go up. But what if I said people that don't have internet access won't have these benefits? And so that to me is an issue, and it actually worries me. Another is today's prices of ChatGPT. Well, we all know that this thing is costing about 700 to $800,000 a day to run. So what's going to happen? What are we going to do? What if ChatGPT tomorrow decides, you know what, this is $1,000 a month? I'm not saying it is, but what if? Then all of a sudden, all these healthcare benefits that I just mentioned to everyone, it goes away. So that's a worry. Just to touch real quickly on some of the naysayers and say, well, it doesn't have references. Well, I'm going to counter with saying this GPT technology has been put in the background for perplexity.ai. I have no stock in them or anything, but I thought it was kind of neat the way you can ask a question and it gives you all the references so that you can verify. Bing Chat does this to a degree. If you put your own references, it'll still point to their references, but it still lets you be able to verify, which is so important for us in healthcare because we want to make sure. Obviously, everybody's heard about HIPAA in healthcare, and in Europe, it's the GDPR, and we need to be obviously careful. There's 18 identifiers in HIPAA, and I'm making sure that my patients and healthcare providers know that not to put any of these things into ChatGPT. But unfortunately, it's going on. We know that there was an issue with Samsung and other companies that are banning ChatGPT. They are worried that if you guys don't know, back in the day, a couple of months ago, unfortunately, a Samsung employee was trying to finish some code that they were working on. Unfortunately, it was IP specific for Samsung. It was highly protective and sensitive. And unfortunately, they entered that into ChatGPT to help them with the code, but they didn't realize that when they did that, that literally under the terms and conditions, they were literally giving that code to ChatGPT. In healthcare, I'm really, really worried about this thing called dependency on AI. I'm personally worried that what if, I've been in medicine for a long time, and what if the clinical gestalt of seeing a patient is gone? Meaning, I see my younger doctors and colleagues that are going to replace me, and when they take care of me, and I worry because I see them ordering CAT scan, ordering labs, doing all this stuff before they even see the patient. And then when they see the patient, they're looking at those labs, and they're working backwards, and they feel like they're losing the clinical touch. They're losing that physical exam, that talk with the patient where they're looking into their patient's eyes, or maybe the way they twitch or move or answer questions. And they're relying too much on technology. And so I personally worry about patients that are maybe using AI over too much, or to the point where they're going to lose some of their clinical skills. But that's just me. The other thing I always talk about is the unknown. We don't know what we don't know. So, what will the future hold? Well, I'm going to predict one prediction here, and I'll have some more at the end of this talk. Is I think we're going to start seeing some fascinating ideas of how to use ChatGPT or a GPT equivalent outside of the United States in healthcare before we see it here. Meaning, risk versus benefits, different countries, they have a bigger problem than we do, and some parts of the United States have a big problem. But with that said, I think the leaders of these countries are going to do the following. Say someone out in Africa, say it's an area that really doesn't have internet, doesn't have healthcare providers. I could see a day where they take a van out there, put a PA in it, and then they put multiple stations with something like this, where GPT is answering questions, but then that PA is there to vet and make sure all that information is correct. And they'll have a system down, and it'll be a way to give people healthcare cheaper, better, because literally they have nothing. And so I think it'll be interesting to see what the future holds. Now, this is one of my favorite personal slides. I think the future will be the multimodality. And I know ChatGPT says they pseudo have it and it's coming. I'm really stoked about Gemini. That is gonna, I think, gonna be probably. I personally think it is gonna be better than ChatGPT, but I can't say until I play with it. So if anyone has access, feel free to send me the access because I love to play with it. But joking aside, as a doctor, these are all different ways of how basically multimodality works. And just for people that don't understand what I'm talking about, imagine taking a picture of something, say a patient's rash, clinical condition, x ray, and then being able to upload it to ChatGPT. And then ChatGPT looks at it, interprets it, and says, oh, that's this type of squamous cell carcinoma. It's this kind of pathology. This is a benign tissue, whatnot. That's what's coming. Now, that's just a picture. What if I said I could take a video of a patient as they're walking, and when I do that, I can see that maybe their way they're walking is favoring their right hip or not. And then ChatGPT would be able to say, you know what, this person's having trouble with gait. There's already technology that our voice can be interpreted for depression, early Alzheimer's, dementia. It's really crazy and scary, but at the same time, great for us doctors because I feel like we have better tools to help our patients. To cut to the chase, ER, as an ER doc, I could take a picture. A lot of times I get patients with overdoses. They come in, the ambulance doesn't know what they overdose on. They literally have these pills, throw them at me. I look at them, I don't know what it is. Big picture, I could take a picture of it, upload it to ChatGPT. They would be able to, the database, this is all theory. Then the database would be able to say, oh, that's Tylenol overdose. This is connected to my EMR that goes to the pharmacy. Pharmacist says, oh, yep, he's got a Tylenol overdose. I have her weight right here. Boom, she sends the antidote, and I would have that literally in minutes. So I already mentioned Google Gemini, the year of 2024. In my opinion, I think it'll be a lot of multimodality and going both ways. So I can have a video and it'll give me text, or I can have text and it'll create a video. And to some extent, this is only going to grow. Microsoft has already announced this is going to be in Copilot, which is going to basically imagine GPT in all your Microsoft products. But the cool stuff is they're saying they're going to put this into the operating system, and that operating system is due for next year. General categories is as follows. We have pre-authorization letters that we can use for ChatGPT. So if a patient needs XY procedure, I can go through and say, you know what, I'm gonna use ChatGPT to help me find references, find things. Again, with the references, we need to be careful because it can hallucinate. It may not give me the right reference, or it may give me the wrong doctor author to the article and it doesn't match, or that article may be great, but it has nothing to do with why I'm writing the letter. So that's one. Epic is working really big right now, and I believe someone that did already release this, where you can have summarization using ChatGPT. So it's basically Microsoft, OpenAI, and Epic working together, but you can have these great summarizations using ChatGPT. The other thing that I'm seeing here is just being able to answer questions for patients, and I think that'll be a possible huge way to help us with our chatbots. The last one I want to talk about is just teaching empathy. Doctors don't do a great job with empathy, so why not have ChatGPT help us with our empathy, help us with our translation? Here's another one I was thinking that'd be amazing. Why not give patients examples in their culture? If I'm talking to someone from South America, I'm lucky enough to speak Spanish, but say I didn't, why not give examples of their culture that are sensitive in that area? Instead of me giving American examples that they may not understand, why not give them those special examples? Quickly, just healthcare. We've talked about medical records management. I've talked about patient communications. Yeah, disease diagnosis and triage is another one. That one, obviously, we need to be careful because that way we may need FDA approval. And there's different ways of doing this, and depending how you do it, more than likely it will. But just from a theory point of view, it should be able to do this. The one I'm really also excited about is this drug discovery and development. There's studies that are showing that drug costs have gone down by 90% by companies that are using AI to discover molecules to work. So I applaud Google for creating a lot of the front end work for showing us these molecules and mapping all these different proteins so that now we can make these drug discoveries a lot quicker. I'm really stoked to see that, and I'm hoping to see more applications, seeing more medical research using LLMs, helping us find information. PubMed has got millions and millions of articles, but what if I'm working at a certain particular aspect and be able to just look for it within seconds and then really have an interaction with the article? It's going to take it to another level. We've already talked about electronic medical records and patient education with their discharge instructions. These are just a few things that are coming. I've already talked about drug development. Personalization of medicine, man, that's a big one. But let's just say if I can cut costs from creating a drug by 90%, well, guess what? Two things are going to happen. One, I can now start creating drugs for maybe if there's only 1,000 people with X disease. Because I can cut my costs down now, I believe drug companies will start specializing and looking at this differently. On the personalized medicine, it's a tangent to what I just said, but think of the human genome. Think of all that information, putting it into an LLM, and then being able to create specific types of medicine. We all know about diabetes, there's type 1, type 2, but in reality, there's actually hundreds of different types of variants. So why not create that different variant for you? Give you that special medicine that is specific to your genotype. And I think that's where we're headed, and we will have this. I think just having that faster access to information is going to help us again deliver new medicines quicker. I think clinical trials are going to start moving a little quicker. When implementing these things in healthcare, obviously, number one is going to be our data privacy and security. Definitely, we have to stay within our regulations of HIPAA and JDPR for the safety of our patients. And I'm not saying that we need to let this thing go on its own. We need to have a doctor in the loop in healthcare or a healthcare provider in the loop. I'm an advocate, and I'm telling all my docs we need to have more docs out there, and nurse practitioner and healthcare workers to help us with these LLMs to make sure that we're making a better healthcare for tomorrow. Everyone's already heard about Khan Academy. But I'm going to highlight the healthcare ones. We talked about Epic EHR. Mayo Clinic is using large language models like MedPalm 2. I love New York Tron, what they're doing. They're basically have their own data inside their own hospital systems that is actually helping them predict with readmissions and other healthcare outcomes, which I think is amazing. I've seen some cool demos on MedPalm 2 and showing how it is actually helping them read x-rays and able to see things big picture. I'm sure there's someone out there listening that says, with these apis I can do a lot of these things, and I applaud you, and I hope you can. And if you do anything in the space or healthcare, please give me a call, because I'm really stoked about this technology, and I want to see it to another level. On the plugin side, I'm going to quickly mention Instacart. Here's a skinny. I'm a doctor taking care of a patient. Patient is a diabetic. They're not doing well. Do their hemoglobin A1C, which is their average sugars. Their average sugars, say it's like 10, which a hemoglobin A1C of 10, which is to say it's like over 200 all the time. And I'm like, they need to eat better. And so, how can I do it? I can literally use the power of GPT, put it into GPT, ask it, hey, I need the following. I need a meal plan. They don't like eggs. They're allergic to peanuts. They really don't want to eat seafood. And then I can tell it, I need a keto diet. Give me a meal plan with recipes and what to buy. And literally, it will make that. And then I can look at it as a doctor or a nutritionist and say, yep, this is all good. And then here's the fun part: the patient can literally put that in their Instacart and literally have it delivered. So by the time the patient's home, that medicine, which is to eat correct, is already there. As an aside, for fun, I created my own plugin. It's called Decision Matrix and Decision Diagram. But the skinny is for healthcare. What I thought is we have a lot of ethical issues in that, how do I do X or Y or business decisions? So I created a plugin to show you that this is how to use the power of ChatGPT plus using this plugin to give you a better output, which again is my way of just kind of helping and figuring out issues that we have in healthcare and how to address it. So, what is the future? I've mentioned before, we need to do BioGPT, we need to do Gatortron GPT, and all this I'm talking about is basically we need a large language model that is 100% for physicians, healthcare, that is specific for your area. So BioGPT, imagine just taking all the PubMed data, meaning all the scientific data that's for physicians, and then putting it into a large language model, and then that would be the model that I get to interact with. Gatortron did all their electronic medical records out in Florida, and they have a certain healthcare system, and they use all that data, and it's just for them for their hospitals, which I think is amazing. Keep an eye out for this company called Glass Health. They just got $5 million recently for their research, and the skinny is it's doctors like me working on the large language model, working on problems, creating something called differential diagnosis, with is all the possible things it could do be, and then treatment plans. But then they're using human reinforced learning, the right doctor on the right algorithm to make sure that that is correct or not, which is really cool. I think that's the way it's going to be. Hippocratic AI is another one that's going to be amazing. They got about $50 million. I haven't seen it, but I just seen what their press release is, and I think it'll be a fun one. Lastly, there's a couple of cool. There's hundreds of different things out there, but this one I found kind of neat. It's Graph GPT. All it is graphing. So if I have a patient here and it's clinical vignette, and then it's creating a graph. Some doctors are very visual, some are very auditory. This is just a way that we can start creating these graph GPTs to help us create better algorithms for when we start seeing different types of patients. So this would be kind of a neat one. So what's the future? I always say you don't need this huge you don't need to bring like a shotgun to the fight. You may only need your fist. And by that analogy is some of the things what we have issues in healthcare, we don't need a big chat GPT. Sometimes for some tasks, all we need is a small language model. I'm going to cut to the chase and just say Apple recently released a the new iPhone, iOS 17, and then on Mac OS of 2023, they have a very small. And I know guys are going to start laughing when I say this, but their model that they put into this thing is only 34 million parameters. So it is tiny. It's probably the smallest, but it's their way of using large language model or small language models, to say the least, to work forward. So I'm excited just because there's over 2 billion of these devices, and with Apple working on bigger projects like Ajax and other LLMs that I think will make a bigger difference, I think this is a good start. And I'm excited to see that one day on my iPhone, I will actually have more and more power to do things and I don't need the internet. So, with that great transition, I think the next GPT is going to be your GPT on your phone. And I think this will be like having a doctor in your pocket in a way, but it'll be running off your phone. I know the AI wars. I made this using Bing.com/create. And big picture, I really do see this struggle between Microsoft. I think they're doing a great job with all the different platforms and secure servers and whatnot. And I think they're setting themselves up great in healthcare. With that said, I wouldn't not count out Google. I think they're doing an amazing job with MedPalm 2, with all their products. And I believe Gemini will be a force. I'm not personally crazy about Bard, but I think it's coming along. Once they turn on Gemini, I could see Bard getting better. I've already mentioned Microsoft, but I do want to shed light real quickly on Elon Musk. Big picture, he's got all the bases of a good house. He's got energy, he's got his solar power. And we know these things take a lot of power. He needs some quantum computing to make it really take it to the next level. He's got that through Tesla. He needs technology. He's got SpaceX. He needs a great team. He literally got a great board behind them. So now each person there's got about, I think they got like $20 million each. So now he's got the making of a huge, huge possible GPT. So I'm really stoked to see what he does and what he wants to do with it. And I hope it is something amazing. And I forgot to mention Twitter, now called X, and he's merging it all. So we'll see what happens with all this data. And I didn't mention Tesla's data on all this driving. So put it all together. We'll see what he comes out with. I'm almost done here with the Claude would be the last one I want to talk about, but the skinny is imagine using other LLMs, not just ChatGPT. So keep an eye out for these that are coming. As an aside, I'm not the best programmer in the world. I'm a doctor, but just as a proof of concept, I took my LinkedIn picture, I uploaded it to ChatGPT, and I said, "Make me a video," and it made a video. So I'm really stoked about all the things that we can do in humanity to help our patients. So again, the future, it's going to be videos, it's going to be pictures. I personally think, and we can do a whole lesson on this in the future. It's going to be robots that are coming out this year, and their eyes are going to have ChatGPT 5 or 4, and then at that point, that model, that robot can help us in the clinic, can help us with patients. The robot can tell me the patient's sugars, their heart rate, their blood pressure, just by looking at them, can assist me. And the more they learn and work with me, the more they'll have my style and understand. And it's not going to replace me. It's going to be my literally my assistant, my supplement, it'll be my helper. I think I'm going to give amazing healthcare having something like that. I think the future will have AR, VR, and AI, basically augmented reality, virtual reality, where I put these glasses on you and say, okay, here's why I need you to take your medicine. It's because of your heart, and it gives you this graphs and explains why we need to what we need to do. I think virtual hospitals are coming in. I'm really stoked about that. And so in summary, big picture, I we all have our niche in healthcare. We all have to see how we can do something different. I'm a doctor. I'm using my doctor brain. I'm trying to see how I can help my patients. Again, proof of concept. I took my voice, I cloned it, I put it into ChatGPT. My business partner and I. It creates a fake conversation through an article. We uploaded it, and it makes the whole talk. And then we literally uploaded it, and it's called the GPT podcast that we made, and it's my way of helping patients, helping people understand AI in healthcare. And it's kind of crazy. I literally took this thing, gave it to my mom, and said, "Hey, listen to this." And she's like, "Oh, wow, you sound great." And she didn't catch that this was all AI. So I think there's good ways of using this. I know people out there like, "Oh my gosh, I can't believe you did that." But at the end of the day, it's about proof of concept, and that's why we're all here today. So if you have any questions, I've written books. One of these QR codes is for my books. The other one's my LinkedIn, and the other one's for the GPT podcast. So I want to thank everyone for coming. And if you have any questions, please reach out.
This concludes today's sessions. I'd like to extend my appreciation to the speakers for their comprehensive discussions on NLP's role in healthcare and life science. We've seen firsthand the potential and the challenges from improving healthcare record analysis to aiding in early cancer detection and refining treatment plans. We continue tomorrow at noon for the third day of the NLP Summit, diving into AI applications in sectors like finance, retail, manufacturing, and advertising. See you tomorrow. Enjoy the rest of your day.